In this presentation, we would like to discuss three main points: the risk factors for accidental poisoning, how to prevent accidental poisoning, and what we can do to treat and care for children who have been victims of poisoning. Toddlers experience maturation in various physiologic systems. Physical growth begins to slow down and take on a more step-like pattern. Toddlers average weight of 26 pounds and have that characteristic pot-bellied appearance. The anterior fontanelle closes and the head circumference increases more slowly. Their visual acuity is 20/40. However, they still may use every sense to explore their environment. They carefully inspect, touch, taste, and may even attempt to shake an object to hear its sound in order to fully become familiar with the object. This specific developmental trait of inquisitiveness during the toddler years makes them highly susceptible to the dangers of accidental poisoning. In addition, their primary dentition is complete between 1 and 2 years of age. During the time previous to that, the child has a tendency to chew, bite, and place things in their mouth as a source of comfort. This is yet another vital contributing factor to this substantial risk. Locomotion is one of the major gross motor skills developed in this age group. Toddlers are now able to walk alone by 12 to 13 months, and by 18 months they can run. This allows them to explore new areas of their environment, thus expanding the zone of possible toxins and injury. Other advances in mobility, like climbing stairs or furniture and reaching higher on surface due to their height, which is increased to an average of 34 inches by the age of 2. Just as comparison, the standard floor to countertop height is 36 inches. Therefore, that is not a far stretch for a toddler, and that has now mastered the ability to balance on one foot or even stand on tippy toes at the age of 30 months. These new tasks give the child more independence to try and climb and explore. They are able to pull objects from higher shelves. This opens up a whole new realm of potentially hazardous household objects. As parents and caregivers, they should be properly stored. Fine motor skills are now being refined in this stage. The fine pincer grasp, usually achieved by age 9 to 10 months, is now highly developed by the age of 12 months. This allows them to pick up very small objects between their fingers. Children of this age are also able to self-feed. Their independence plays into this because they now have the ability to choose what they place into their mouth. According to Erickson's psychosocial stage, children between 18 months and 3 years of age are in the stage of acquiring a sense of autonomy and overcoming a sense of shame and doubt. Because of their growth in physical development that is also occurring, toddlers acquire many new abilities. Curiosity, learning, and independence take over the desire for caregivers to fulfill their every need. Carrying out their own will provides self-fulfillment, but at the same time carries negative consequences. While a child is able to remain dependent on caregivers, feeling safe and familiar, this is also limiting to the child. Remaining dependent also is counteractive to their autonomy, making the child doubt their own abilities and feel shame for wanting to control their environment. Toddlers struggle with the balance of independence and guilt of rejecting the parental care. Discipline and consistent limit setting is important for this age for the child to understand what is appropriate and what is not appropriate for them. Success in this stage of development relies on the balance of self-control and self-esteem in the child. Along with finding independence, toddlers experience what is known as magical thinking, which is what influences their concept of self and intention of action. As seen in the previous video, when a toddler reaches the Piaget's cognitive level of sensory motor, they strive to learn about the world around them through senses and motor activity. They're able to complete simple repetitive behaviors, and their curiosity and examination enable them to learn and explore their environment. This, however, poses a significant risk for the factors that play a role in poisoning. Along with the increased locomotion and independence that comes along with the toddler years, we have an increased concern for safety during this time. Certain skills and traits that they are able to grow and develop put them at an increased risk for poisoning. Upon research, we found that 49%, almost half of all cases of poisoning, occur in children younger than the age of 6. The statistics also show that 91.29% of accidental poisonings occur in the child's home and are by common products. In 2009, the most common product exposure in children under the age of 5 were cosmetics and personal care items at 13% and cleaning products at 9.3%. Meet Corbin Mott, a 3-year-old Caucasian male presented to the emergency room with complaints of severe abdominal pain. His mother, Miss Jacobs, reports she was found him drowsy, sitting on the kitchen floor with an empty, open cleaning bottle beside him. She suspects he stood on his tiptoes and pulled the solution off the counter and opened it while she was doing the dishes. She states that Poison Control Center was called, and she was advised to check the airway and breathing, in addition to withholding Ipecac administration. She was also advised to bring her child to the emergency department for further evaluation immediately. Let's talk about nursing implication and recommendations that we can do to prevent accidents from occurring. For nursing recommendations, in order to prevent such an accident, we recommend the following. Store prescription medications, all other kinds of medications, vitamins, herbal supplements, essential oils, and alcohol in a locked cabinet. Keep all medications and cleaning supplies in their original container. Never use any type of food container. Keep toxic substances such as antifreeze, fertilizers, bug control substances, and many others in a location that is in the garage and locked in a cabinet as well. As we mentioned in the previous video, when childproofing your home, get down on your hands and knees. Look at the surrounding and the environment from their perspective. You might find many hidden traps for safety. Never refer to medication as candy or alcoholic beverage as juice. Children in this stage want to be just like their moms and dads, and this is where the role of imitation comes in. If they see mom and dad taking medications, they're going to want to try and take medications just like you. Be very aware of what you do in front of your children and how it is portrayed to them. Be very aware of the possible dangers in other people's homes, especially your grandparents, as they may not have the childproof that you do. Be sure to put all bags and purses around your home, because it's easy access on the floor for children to crawl around and get their hands onto things in their purses, such as pepper spray, makeup, medications, lotions, and many, many more. Encourage first aid products to be found in the event of an emergency, as well as the Poison Control Center's number.
Hello?
Although we can do everything in our power to prevent this from happening, it can still occur. So we are providing you with the nursing recommendations for the treatment of accidental poisoning in the toddler's age. If poisoning is suspected, check the airway and breathing of the child immediately while calling Poison Control at 1-800-221-1222. Know the height, weight, and age of the child to be able to give the Poison Control as much information as possible. Unlike what many people have been taught, the use of Ipecac syrup is no longer recommended, as inducing vomit with the child has become more harmful than helpful. Do not implement any type of home remedy unless instructed by Poison Control. Contact 911 for emergency situations and prepare to take the child to the emergency department as soon as possible, depending on what Poison Control instructs. For the best possible outcome, it is recommended that you seek help within an hour of ingested toxins. Nursing diagnosis number 1, risk of poisoning related to accessibility of poisonous materials. Our nursing interventions include educating the parents on age-appropriate preventative measures and safety precautions. Also including, when poisoning is suspected, how to care for a child in the emergency event, as well as being able to triage a patient who comes in for poisoning. Nursing diagnosis number 2, acute pain related to chemical injury agents. For our nursing interventions, first we would assess the pain using valid and age-appropriate pain scale, administer prescribed analgesics, and prevent additional pain. Corbin, after being assessed, is ordered activated charcoal, IV fluids, and oxygen. Reported to be stabilized and responsive following the nursing interventions and proper treatment. Ms. Jacob reports her son demonstrating signs of improvement based on his mood, actions, and behavior. He received discharge ordered to return home with his mother. During the discharge, the nurse commends her for following the procedure in the case of suspected poisoning in the state of emergency. The nurse also educates her regarding the risks involved.
Even though poison control calmly walked me through the situation, it was still very emotional as a parent. And I was starting to question my parenting skills. I think as a nurse, we need to take opportunities like that to educate and empower families about child appropriate developmental stages, milestones, and also the importance of prevention without being judgmental. Parents need to know how to make sure medications and cleaning supplies are locked up high in cabinets. Not just put up high, they need to also be locked because children can climb. They need to make sure that they don't take medication in front of children or call it candy or juice, that type of thing. If a situation unfortunately arises, to contact poison control immediately. Don't use any type of home remedy, and get to the emergency department if needed within an hour. I think together, if we work with families and improve the education, we can really reduce the amount of toddler poisonings that we have here in the United States.